Hi, and welcome to the first episode of On the Beaten Track. I'm your host, Rihanna Levesque. This is super exciting and very, very scary, but I'm so happy you're joining me on this journey. Today, I'll be doing a deep dive into autism spectrum disorder and our journey to our son's diagnosis. While I'm sharing this journey with you, I'll pepper some facts and definitions throughout the episode, and you will find some my sources in the show notes. As always, you can do your own research, but this should give you a really nice starter. Okay, so when you think about autism, what's the first thing that comes to mind? I think people get this like view in their mind. It's like a very stoic, like very sad looking kid, doesn't make eye contact. And that is actually classic autism. But today we're talking about autism spectrum disorder. As you can see, there is a range that we're talking about here, and we're not just talking about that one view through that one lens. So hopefully we can open up your mind with regards to what all falls under the autism spectrum disorder. Let's start with what it is. So from the World Health Organization website, it states autism spectrum disorders are a diverse group of conditions. See, diverse group of conditions. That's very important. They are characterized by some degree of difficulty with social interactions and communication and behavior impairment. Now, the sentence might sound weird, but it's social interaction and social communication in one bucket and behavior impairment in the other. So, autism spectrum disorder includes conditions that were previously considered separate. Okay, so I don't think a lot of people know that. They were all brought together under autism spectrum disorder. So, what were those conditions? Okay, they were autism, Asperger's syndrome, childhood disintegrative disorder, and an unspecified form of pervasive developmental disorder. Okay. So the reason why they were grouped together is because when we're talking about that social interaction, communication, and that behavior impairment, there were similar things happening throughout these disorders that just felt the same. So they put them all together. They had similar traits. Okay. The World Health Organization states about 1 in 100 children has autism. That seems a lot, doesn't it? Characteristics may be detected in early childhood, but autism is often not diagnosed until later. I don't think that's true anymore. I feel like when we started this journey 11 years ago, there wasn't a lot of details, or it felt that way, obviously, as you're starting out. It doesn't feel like you know where to go or who to contact. But there wasn't a lot of like facilities catering to autism spectrum disorder. I think that you find there's a concern now that so many kids are being diagnosed, but I think there's more knowledge around these disorders, and now that they've been brought together, I think there's a better diagnostic pattern or me talking like I'm a psychologist here. Maybe better guidance by bringing them all together. So I think that has helped. We'll dig into it more throughout the episode, but let's get into story time. Start with my pregnancy. My pregnancy, I didn't think I would like being pregnant, loved being pregnant. But, you know, like that duck, everything seems cool on the outside. And like, as they're going over on the pond, and then underneath, they're just like, that's what was going on here, you know, in my body. So I was fine, I felt fine, but everything underneath and in my tummy was just not going okay. So we had our first scan, big scan, I think, and he was showing very low growth. The doc actually thought that he was going to be a dwarf, and we were like, okay, well, he was already talking to us about considering abortion, which I thought was strange. We asked, okay, so, you have Down syndrome, you do have a test for that. Do you have a test for dwarfism in utero? He said no. So he said, okay, well, we'll try and get a second opinion. So I had scans every 2 weeks until 24 weeks, because we were just really keeping a very close eye on that growth, which was, he was in the fifth percentile. So that's like very, very low. We had an amnio. There was no down, so that wasn't a concern. I had high blood pressure. I do think it was the weekend we were getting married, so I don't. Yeah. Anyway, I had high blood pressure, so I took meds. Then, towards the end of the pregnancy, what we would have termed as 35 weeks, my amniotic fluid in my tummy was going very low. There was no concerns about that. But then, I think within 24 hours, we were in hospital. I had steroid shots to help his lungs. And and then we tried to induce. That didn't work. So we went in and we got him, and I got a little sunroof. That's what the doc called it. She was very funny, and it was very fun. He's born by C-section. He comes out wailing, which is great. His APGAR scores were 9 and 9, which was good. The only thing was that he swallowed amniotic fluid. I mean, my fluid was low, and he still managed to swallow amniotic fluid. But that did mean that his stomach was pumped, and it did mean that he was in the ICU also because he was quite small. He was only 2.1 kgs. He was in neonatal ICU for the first 2 weeks of his life. So when the doc saw him, which was the pediatrician, which I didn't really know, he checked his hands and his feet, and he said that, it's saying 35 weeks, but he's presenting as a 30-week-old baby, which I think just ties back into the slow growth in utero. Okay. So the reason why I wanted to go through the pregnancy, when I started going into the community, I really thought that there would be similar stories. You're looking for cause and effect, right? So I thought, okay, there will be people with similar stories. In actual fact, I found that there were few women who had similar or, you know, similar adjacent stories to mine. But what it does say is that health complications during pregnancy and in childbirth may raise a child's autism risk significantly. A baby experiencing complications both during and before birth may have a 44% increased risk of autism. So that was very interesting for me when I saw that stat. And I thought that, there'll be more people. Actually, there wasn't. There's not. The one that I see a lot being in the community is a child has an approximately 19% higher risk of autism if an older sibling is on the spectrum. So that generally happens when that I've seen is that the kids are born really close to each other, and then the one diagnosis comes through and then the other one comes through. So that I've seen more than the trauma birth story from someone. Once we got him home from the hospital, he was a dream. He was a little bit boring, actually. This dude just wanted to sleep all the time. Obviously, he was premature, he was very small, so we needed him to eat, which meant that generally I was waking him up to feed him, which he was not happy about. So, he was hitting his milestones, I think, within that 7-week period, with the delay that you expect from him being premature. He was still hitting some of those milestones quite nicely, actually. When he got to about 8 months old, we noticed he was super stiff. So, for him to crawl and move looked very difficult. So that was the first time we went to physio. And that physio, Mary, is still in our life. And that helped tremendously. I don't remember how long we were with Mary for the first time, but we went through that process. His movement started getting better, and then we discontinued that therapy. Then we noticed that all of a sudden, I think after a year, you start to notice that his milestones, the hitting the milestones was slowing down, and they were not being reached as much. He had some words. He had mama and papa and ta, and he used them in context. And after 18 months, we had to go back to the physio because he was falling around a lot. He wasn't trusting his body, and he wasn't very steady on his feet. And then we noticed that in actual fact, those milestones had just slowed down dramatically. My husband and I started talking, and we decided, okay, we need to take him somewhere because there is obviously a problem. At 2 years old, we went to an early intervention center where they evaluated him. I did feel a certain way about the diagnosis for years. Well, actually, for years until the other day when I actually researched when they moved those separate diagnoses under one. And I remember this woman saying to us that he's not autistic because he looks you in the eye. But I do think that was a year after they changed it on the DSM-5, which I'll explain now. They noted that he had a speech and development problem and that we should go into intense therapy for the next year and see how much movement we can get out of it. So that was physio, OT, and speech therapy. And this was our first foray into creating a team around Enzo, which we still have today. And that was to make sure that if we were having these 3 therapies every week, intensely going at it, that we needed to make sure there was an overlap, that they weren't going for the same goals, which at some stage physio and OT kind of felt that way. So we built this team, we bring them together, we have the discussion, and everybody has a clear goal with regards to what we are trying to achieve over the next 6 months. This set about an 11-month process of, like I said, OT, physio, and speech. Speech was almost non-existent progress. OT and physio were getting progress, but it was really slow. And we, at that stage, weren't completely happy with the diagnosis. We felt there was something more. Something more could be done. We needed more information. We felt like there was more here. And my husband started speaking to somebody that he worked with who also had an autistic kid. Said, this is the doctor that we went to, go and have the evaluation if it is. If it isn't, either way you'll know. And we ended up going to a pediatric neurologist. Okay. So once we got an appointment and went for that assessment. Before we go into our assessment results, I just want to talk through diagnostic criteria as it pertains to autism spectrum disorder. This is the diagnostic criteria as prescribed by the DSM-5. The DSM-5 is the Diagnostic and Statistical Manual for Mental Disorders. I did double check with my sister, who is a psychologist in South Africa, and this is set out by the American Psychiatric Association. And in South Africa, psychologists and psychiatrists do have to know the DSM-5, so it is relevant. Okay, so I said before we spoke about social communication and interaction and behavior. So what I want to talk through, and the Mayo Clinic breaks it down really nicely. So we'll talk about what the DSM-5 says, and then I'll just tell you the behaviors that kind of pertains to that. So we look at persistent deficits in social communication and social interactions across multiple contexts. They can look like struggling to make eye contact. They struggle to carry on conversations. They don't understand the concept of taking turns in conversation or reading people's body language. They're not very good at reading a room. I guess that's what we're saying here. So when we look at that, the Mayo Clinic, which is also in the state, it says, fails to respond to his or her name or appears not to hear you at times. The amount of times doctors have told me in the beginning to get Enzo's hearing tested, that boy will hear something. He will hear me sniffling in my room and he's upstairs and he'll come running. There is nothing wrong with the hearing, I can tell you that much. Resists cuddling and holding and seems to prefer playing alone, retreating into his or her own world. Has poor eye contact and lacks facial expression. My son does not have this problem. Doesn't speak or has delayed speech or loses previous ability to say words or sentences. Absolutely. Can't start a conversation or keep one going, or only starts one to make requests or label items. Speaks with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech. Repeats words or phrases verbatim but doesn't understand how to use them, so context is missing. Doesn't appear to understand simple questions or directions. Doesn't express emotions or feelings and appears unaware of others' feelings. Doesn't point at or bring objects to share interest. Inappropriately approaches a social interaction by being passive-aggressive or disruptive, or just go and stand and stare in people's faces, which is always very nice and orcs, because then he's just like standing as people are having a conversation. Luckily, he's cute. Has difficulty recognizing verbal cues such as interpreting other people's facial expressions, body postures, or tone of voice. Okay. So that's your social interaction and social communication. Then we have patterns of behavior, restricted, repetitive patterns of behavior, interests, or activities. So this can include repeating the same movement or phrases, needing routines to stay the same, or having deep interest in specific topics or objects. Perform repetitive movements such as rocking, spinning, or hand flapping. I have a hand flapper. I also have a jumper. The world is his trampoline. Everything is a trampoline, even the floor, which is very funny. Performs activities that could cause self-harm, such as biting or head banging. Develops specific routines or rituals and becomes disturbed at the slightest change. Yes. Has problems with coordination or has odd movement patterns such as clumsiness or walking on toes, and has odd, stiff, or exaggerated body language. The amount of time when we were going through this process and going to, professionals, that people asked about the walking on the toes thing, which he's never had. I mean, he's a jumper. So I get he interacts with the world basically that way, but walking on toes, I don't ever remember him doing that. And maybe it was because it was a thing of the time, but got asked that a lot, actually. Is fascinated by details of an object, such as spinning wheels or a toy, but doesn't understand the overall purpose or function of that object. So it's kind of like, I see the car, I spin the wheels because I'm really obsessed with spinning the wheels, but I don't know that I need to drive the car. That's the appropriate play. Is unusually sensitive to light, sound, or touch, yet may be indifferent to pain or temperature. Doesn't engage in imitative or make-believe play. Fixates on an object or activity with abnormal intensity or focus. We have two things at the moment that he's absolutely obsessed with. The Bon Mama lid, which is a checkered lid. And the second thing is his Freedom Park socks, which is a trampoline park or play park that we have here in Cape Town. Absolutely obsessed with it. I think the other one is because it's quite bright, but he's forever just turning it over in his hand. Has specific food preferences, such as eating only a few foods or refusing foods with a certain texture. So I hope that gives you kind of something to connect when I say social interaction and social communication and patterns of behavior. So that's what you're looking at. And, as I'm saying, as I was walking through it, I recognize things that my son does. Okay. We went for the assessment and had the assessment feedback. That was the day. Sitting there and listening to the diagnosis, which was great because it really was a true reflection of who our boy was. But then listening to what his life could be was like a blow after a blow, sitting there and like having to absorb that, and not really understanding at some points. Enzo's official diagnosis was autism spectrum disorder with a global developmental delay within the moderate range. Further genetic testing is advised. So the full enormity of what our lives would become as a result of this is obviously not known in that moment, but she is giving you some kind of understanding of what could be problems, what we need to look out for. And every detail was scary, but I think the one that stuck with me the most that day was that he might not ever speak. And I did not know about nonverbal kids. I did not understand. I mean, we've had family members who were deaf or dumb, but I just couldn't wrap my brain around it, and the impact. But really, it felt so massive to me. So let's walk through the developmental screening assessment results, and then we can just talk more about the after effects. She used the Maltino developmental scales, which is a developmental screening tool for children up to 5 years of age, used by medical practitioners in the Western Cape, South Africa. It generates subquotients for language, personal and social, fine and gross motor domains. Okay, so that's talking about what I was saying earlier: social interactions, communication, and then behavior. Okay, so those are kind of looking at them specifically. So at that stage, he was close to 3 years old. So it says 35 months. Developmental quotient was 44%, which indicated a global developmental delay. And when you look at his, the months he was for each of this, you can understand how it all comes together. So his gross motor was 21 months, and that he had been in physio for an OT for a while. Fine motor, which was blocks, was 10 months. Form boards or berry, so some of these he didn't engage on, and she couldn't really get him to interact with certain things, so there was no results for those. His language was at 15 months. His personal social was at 15 months. Like I said, his results were far below or far away from where he was at close to 3 years or 35 months. So we sitting within the first year and a half, maybe, with most of it, and some of it even in the first year from his capabilities at that stage. What was great about the doc was that she gave us a whole lot of recommendations, and that was, great, because you just getting all this information, you don't know where to start, you don't know what's the first thing to do. But those were kind of some of the questions that we asked that day. So she gave us recommendations to see genetic specialist, which is Professor Grieke de Jong, who we did see eventually for any further genetic testing, hearing and visual assessment. So Brother Man does not have a hearing problem, but he does have a visual problem. She recommended that we look into the Gemini program, which we did do with Enzo for a while, actually. Look at getting placed into a structured learning environment for kids like him, which was one of the first things we went through, and then to look at any additional therapies that he might need. So she gave us quite a list of things. That was the first thing that we had to do, was get him into a good school, learn more about autism spectrum disorder. So that really put my husband into action, which, if you know him, that's craziness, how quickly he can get you in anywhere. And then for anybody wondering, Enzo did not have the MMR vaccination by the time we got the diagnosis. There was some strange shortage in the country at that stage. So he got it later on, I think a year or so after the diagnosis, but he hadn't had it then. And I think a lot of people want to know that. Getting the diagnosis is relief and grief all at the same time. You finally have something that's really fits your child, and then you have an action plan on what to do, but you're grieving your child having a neurotypical life, right? I bawled my eyes out driving back to work, grieving, also thinking to myself, what had I done? And that's normal. From there, we had to learn everything. Sasha, my husband, went into action man mode, or wolf mode, if anybody knows him. He was incredible in getting us into medical spaces, schools, interviews, assessments, anything that we needed to do. We really there was no waiting list or very long list. He went into action and got us into everything very quickly. We started our journey with doctors. I'll go into more detail later. We were actually in the process of trying for our second biological child, and we were going to adopt our third. And we had put that on hold. So we went to see a genetic specialist, Dr. Griekie de Jong, who was the sweetest. She assessed Enzo. She looked at his features. She looked in his mouth. She looked at his feet. And she said there wasn't anything specific that she could point at genetically. She said we could have a test, and that would cost quite a penny. There was a 5% chance that we would figure out which gene, or if there was a genetic problem, essentially. And there would be an even smaller chance that there would be something that we could do about it. I mean, we couldn't do anything for him, but if we wanted to go down this route for our second child, we could. And we decided to kind of scrap that concept, scrap that idea, and just focus in on Enzo. I still want to find the study where I read this in, but I found it quite fascinating because it just really confirmed what she was saying, and that it was not a fool's errand, but that it's so unique. Like they say, when you've met one person with autism, you've met one person with autism. They are uniquely themselves, right? So, but it did give me later on comfort that we made the choice not to. It says ASD is a multifaceted disorder with a complex genetic basis. Over 200 genes have been implicated in ASD. That's insane. 200? Wow. Many of which are involved in synaptic function. Yay, me. Neural development and gene regulation. So 200 genes. Amazing. Okay. I once heard somebody describe autism beautifully, and I wish I had saved it. Sure, I could give her credit, but if I'm really, it's really just such an amazing explanation, and I hope you feel the same way I do. Maybe I've hyped it up too much, but okay. So they said the traits of autism, like sensory processing, which is massive a lot of the time, communication, repetitive behavior, motor skills, and social awareness are like knobs on a stove. Okay. Each one is turned to a different setting for each child or each person. So for my son, verbal communication is low because he's nonverbal, but the repetitive movement one is high. The idea really helped me to understand and appreciate all the kids that I see around us, right? But yeah, I thought that it was an amazing explanation. I hope you feel the same way. So dealing with the diagnosis personally, it's been hard for me at different times. Initially, you're asking yourself, oh, what could I have done during my pregnancy? Could I have done something better? Always turning in on yourself rather than external. Always wondering. I mean, I housed him for 9 months. There must have been something that didn't work. But that doesn't help you or your partner. I take maybe a bit longer to come around and really work my way through those emotions. But I was really lucky that while we were, wadding through this, I could say the ugliest thing to my husband, and we would walk through it together. And that really helped a lot. Our biggest thing was not to berate ourselves. That was one of the reasons that we kind of also gave up on the genetic testing, to kind of go, who's the cause? What's the purpose? What's the purpose? Okay. We made this child together, and we love him and we love each other, and there's no reason for there to be, oh, well, this is your fault. What's the purpose of that? It's not helping anybody. It's not helping him and it's not helping us. And we really, most importantly, we had to be a united front with everything, every decision, every place we went into. We tried not to split up. We did that later on, but initially we went to every meeting together, and we couldn't go in different directions. We had to be pulling in the same direction, and that helped tremendously. Communication. What makes a happy marriage? Communication, guys. And checking in on each other became like a massive part of our lives, and we were purposed about it. Sometimes it felt to the point that it was unnecessary, the amount of times we were checking in on each other. But the minute that we don't do that and we don't communicate, and things might go a bit silent, and we might go into a lull of, complacency, then it all shows up in the boy. There's always something that we see that impacts him because we weren't communicating, or I didn't say the thing I thought, oh, I've changed this. And I changed this and didn't communicate. That's massive, because when something goes wrong or he's behaving in a certain way, the other person is without that piece of knowledge. So it's very important that you being purposed about checking in on each other, because this is hard. It's not easy. And that you are communicating at all times and everybody's on the same page with regards to where little dude is at. I have cried many a tear for my boy, for the life that I wanted him to have. And then I look at him, and he is devoid of ego, no malice, no hate. He's in a world of sometimes of his own, but he doesn't pay no mind, and he doesn't need affirmation. Oh, no, he doesn't. He loves getting a good boy. That was wonderful, my baby. He loves that. But he doesn't go through life looking for it, right? He doesn't change his behavior because of people, but because it feels right for him. Wouldn't it be great if we were all like this? When he wants to leave and it is go time, we are going. He makes it very clear when the situation is too big for him and there's too much going on. He takes my hand and starts walking to the door. Then we are going. So I'm not going to say my tears are wasted, because, when you don't have something, it's good to go through that emotion and grieve it. But I was really crying for something that doesn't exist and wasn't going to exist. It only existed in my mind. We both had dreams about Enzo speaking to us all the time, being a nonverbal kid. I don't know if other parents with I'm sure they do. It's a recurring dream for me and his dad. We don't think it'll come to pass, but we work on it every day. And sometimes he'll say something and then I'm like, oh, okay, we'll go. The other day he just said no to his sister when she wanted something. So there is language in there. He still says mama, which I'm very grateful for. But we have actually pivoted to nonverbal communication techniques, which has been immensely helpful. So if he wants his cartoon on, he'll bring the remote. If he wants something to eat, he'll bring me a banana. So we've learned. Or he comes and fetches me and then stops, and then I must figure out what he wants. But it's always funny. As he grows, at certain times, the heartbreak comes and goes, so it's not always gone. And him being a nonverbal kid still scares the hell out of me. Especially during COVID, we really did not want him to be in the hospital. But generally, he's such a good boy. And if he's not going through a manic episode or a down spiral, he's just very loving, wants to always give hugs, but doesn't want to receive them. Always on his terms, this boy, which is always funny. So one of the things that you will go through while you're navigating this diagnosis, because there's things to be learned and there's things to understand about your kid and who they are in their diagnosis, because as I said, they are very unique. So you spend a lot of time explaining to other people, and people have some curious questions. People have had questions in those beginning months that I did not have the answer for. Like, how's his life going to be? Is he always going to need assistance? And those hurt like hell because I didn't know. I don't know. I just wanted to scream, I don't know. We are here. We now know, and we will find out as we go. And that was really, really hard in the beginning because anytime I couldn't answer something, I felt like a failure. I felt that I wasn't doing it right. But you just have to, block these things. It's not easy. Listen, I am the one who for a very long time couldn't take my son out because I hated people's reactions to him. He didn't give two freaks about what was going on around him. He was having a good time, or he was having a little bit of a moan. And I just hated the way people looked at him, kids looked at him, and it just really bugged me. It was my thing to get over. He's not embarrassed. He's just going through the world. And then there are the people who have the advice. They know somebody who knows somebody, or they watch something, or they saw this thing on the interwebs and want to tell me about it. I do like different perspectives, but initially there's just so much coming at you that people are like, oh no, this is a cure. This is no cure. There's no cure, and that was really hard in the beginning. So what I did was I looked up, because I have had this in the past where, the common responses that people have, some of them are hurtful, some of them are dismissive. So I'll just go through them, and some of them I have had from people. So from the dismissive or hurtful, what did you do during your pregnancy? That one, yeah, since I already was asking myself the question. Yeah, okay. I'm so sorry. This must be such a burden. Yeah, I don't like when people say that. Have you thought about a cure? Are you going to put him in a special school? Do you think vaccines caused it? Love that. Oh, the best. That child is just naughty. You must just discipline them. So those are a no-no. Don't say that to people. Don't. Then it's like, some people are curious. So they're like, what does that mean exactly? And sometimes you don't know. You just know this person that is your person and your experience with that. It might not be somebody else's experience. I've got a nonverbal boy. There might be a verbal boy. They're both autistic. It's not exactly the same thing. Does that mean they like Rain Man? What's his special power? What's his superpower? I get asked that a lot. My child's superpower right now is that he can go and look for this. He can find the smallest dot of something and rub it for hours. That's his special power right now, people. That's it. That is Enzo's special power right now. Can they talk? Is it contagious? Oh, wow. I haven't gotten that one. Oh, I would feel a certain way about that. But they don't look autistic. Oh, no, my boy doesn't. He's fine. He looks special needs, right? By the way he interacts with the world. But he's Harriet, I'm going to call her, he's Harriet, is always grooming him amazingly, making sure that his fit is looking nice, making sure that his hair is nice and he's nicely groomed. She's like, he doesn't always have to look special needs. His behavior already sets him there. Are you sure? They seem so normal to me. I haven't got that, but I have seen people do that with kids. My friend's kid, yeah, is autistic too. He's a genius in math. What's your kid's superpower? I just spoke about that. Have you tried the special diet therapy supplement, camel milk? Blah, 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 blah. We work with professionals, with a set of professionals, and I'll be going into his gut and diet in the next episode. We've got this. Maybe they'll grow out of it. No. We're all a little autistic, aren't we? Yeah, I love that one. I've never identified as, but good for you. Some nice and supportive comments. How can I support you and your child? You're doing an amazing job. I don't know much about autism, but can I ask you questions? I still sometimes feel uncomfortable about that, but I'll answer as much as I can, as I do today. Thanks for sharing with me. That must be challenging at times. How are you doing? My husband and I are both quite strong, get on with business kind of people. There's not a lot of people that ask, how are you doing? We have to ask each other that, and we have to, like I said, be purposed in checking in on each other. It's weird how many people don't ask, how are you doing? So we celebrate every last achievement because my 13-year-old boy last year was able to feed himself for the first time. There's some tricks, but he can feed himself, kind of, sort of. And my biggest achievement last year was getting him to climb up onto his changing table because he's still in nappies. Climb up to his changing table so I could change him. That was massive. So I wasn't breaking my back picking up a 13-year-old. And the other big thing was for him to, he's always helped with his arms, but to get him to understand that when I bring his pants, that he lifts his legs. And that was a massive moment. And I cried and it was awesome. And he was happy with himself. I don't know. He just saw my joy, I think. And he was like, yeah, it's just so good. So we really, really celebrate every moment. Some people are like, well, it's not that different from raising a normal child. And I go, yeah. If you are still changing your child's nappy when he's almost 14 years old and feeding him most of the time, and he's still drinking out of a sippy cup, maybe it's not the same, right? So, yeah, that was just comments. There is a way to approach things. I know we can all be super awkward in those moments. But I hope I've given you some tips and tricks there of what not to say and what you can say. Originally, when, you're going through this, there's always certain people you expect better of. And for us medical professionals, originally was just the worst. The worst, or the most like sometimes scared of him. So Enzo had grommets put in and laser surgery for his nose because he's a bleeder like his mama. And my husband had to do all his pre-ops. His ENT said, well, just get him an iPad and he can communicate with it. The last iPad ended up, and the last one I ever bought, ended up in the bath. So, didn't work. Yeah, no. So they are professionals in this field that you go and you take your advice from. There are certain things that people might suggest or they have heard something about it. That's why you have a group of professionals that you work with, the team, as I spoke about earlier. So, and when you go into those moments where people you expect to be understanding or not, I think the important thing for us was always to say the thing, that you guys, this can't be the first hyper kid. This can't be the first autistic kid that you've had in here. Like, what's the problem? You're going to have to deal with this. Yeah, I think recently he had laser surgery on his eyes. As I said, he's got a vision problem, and that was night and day from our previous hospital experiences. They were amazing. They turned the fluorescent lights off because they knew it would irritate him. They gave him his own room. The girl who did his check-ins was amazing with him. The doc who was doing the surgery asked what's his favorite song so she could put it on in the theater and play it for him before they put him under. And I just thought that was just absolutely amazing. It was a completely different hospital, but I just thought it was just night and day from what we originally went through. And here we are, 11 years later. It's a daily journey. It's a daily struggle. The last 2 months have been less than ideal. Let's go with that. There's a lot that you have to learn, and one of the biggest things has been patience and not to rush what is not yours to learn. Be persistent, but not forceful. And our boy isn't world ready. I don't know if he'll ever be. We work really hard to get him to be self-sufficient. But he is a happy boy and he is less behaviorable and able to communicate in his own way. Are levels that I've seen that they've put out with autism spectrum. So there's level, if you do come across somebody talking about the levels, there'll be ASD 1, 2, and 3. So 1 is requiring support, difficult in initiating conversations, organizing and planning problems, hamper independence. ASD level 2 is requiring substantial support, limited social interaction based on special interest, harder to shift focus from one activity to another. And level 3 is requiring very substantial support, severe difficulty in verbal and non-verbal communication, extreme repetitive and restricted movements. I think we are at level 3. Okay. Before we go, I just made some notes on the lessons learned and important points that I wanted to share through our process. And hopefully that came through in our story. So trust your instincts. If something doesn't feel right, act on it. Early support can make a big difference. So if it doesn't feel right, go and have it checked. Don't let fear hold you back. Avoiding a diagnosis won't help your child. If you're noticing things that are wrong, go for it. Don't fear the diagnosis. The diagnosis is in the end, it's the beginning. By getting that diagnosis and understanding your child's little dials on their stove helps you to get them the tools and the help that they need to get them more independent. I find a lot of kids that are way more capable than my son, just that intense sensory integration. If that's what the child needs, go for it. And it helps so much. Understand the basics of the diagnosis. Learn the foundations, but focus on your child. Your child is a snowflake. They are unique. And, you need to know what those things are. Like I spoke about social communication and behaviors. All of those things are important to know. But then what do you do to help your kid with that? That becomes, well, how does your kid present for autism? And what are the things that kid needs? And that's the important things to know. Seek out the right professionals. Specialists exist for a reason. Not everyone is an expert, so lean on qualified medical and developmental professionals for guidance. That has been immense. And even sometimes we've worked with people and it hasn't worked out, and that's fine. You're trying different things. You're looking at different ways to go about it. But if it doesn't align with what you want, then try the next person. We have worked with a homeopath now since the beginning of COVID. And that remedy saved us. But we worked with a homeopath before that, and he just wasn't listening. He wasn't listening to what we were saying. He was giving our kid things with sugar in it, and we just found somebody else. Keep the focus on your child. The journey is about helping them thrive. It's not personal. Don't take feedback as criticism. I know we've gone to so many specialists and they are so scared to tell us how bad it is. We know how bad it is. It's our boy, And, your child can't do this. Okay, so professional person, how do we do this then? How do we get there? That's very, very important. It's okay not to have all the answers. That's a hard one even for me to say. It's okay not to have all the answers. Are you kidding me? That's basically my whole thing. I have all the answers. I don't, but that's the way I think about myself. Parenting is a learning process, whether your child is neurodivergent or not. And never stops. Child goes into different, he's 40. Puberty. The hormones. Thank God for global developmental delay at this stage. But the hormones are starting to hormone. So we're getting there. And last but not least, you are doing great. You are doing great. You listen to this podcast where they say, you are the CEO of your child's life. That's true. You determine what happens. You don't have to be perfect. Just be present and observant, knowing who your child is, being able to know all his supplements off by hand, being able to know, I don't know how many times I've told the birth story. See how I ran through that? We had to go through that quite a lot. You are the key component of your child's care and how they go forward. You and your partner, or if it's you alone. Oh wow. If it's you alone, I have so much respect for that. And when a decision is made, like I said, and it doesn't work, pivot. Just pivot. And learn. That's what we've done. And you can do it too. Thank you so much for joining me on this first episode, and I hope you enjoyed my deep dive. Next, we'll be going into still a little bit more of Enzo, and what I've found very interesting is the gut. So in the next episode, I'll be unpacking that. I'll be talking about how we got to his specific diet and what works and what doesn't work for him, or eating plan. I don't know what you want to call it, whatever you want to call it, and what we do for food for him on a weekly basis. Just sharing that all with you. Thank you so much for joining for this episode. I hope this is the first of many. Please subscribe on wherever you're listening to this podcast, and I'll be back next week, every week, hopefully, to unpack a new story with you. I just want to say a big thank you to my husband and my family and my friends who have been very encouraging through this process. Then a special thank you to Andy Matumela, who helped to do my setup. I thank you so much for the time and all the advice that you gave. So just to end off with Ma Joyce's sage advice, the world is your oyster. Go and get it. So let's go. Let's do this. Thank you. Bye.